Henry Ford, just one of many healthcare systems trying to stay on top of the COVID surge. Tonight on our 7 Up Front, we want to welcome Dr. Rudolph Valentini, Chief Medical Officer at the DMC and Children's Hospital of Michigan. Doctor, thank you so much for joining us tonight. We really appreciate your time. We do want to begin with this question. What are Michigan hospitals doing to keep up with the increase in patients?
Well, this is definitely a big challenge for the Michigan hospitals. As you mentioned, southeastern Michigan's been really heavily afflicted in the past couple of weeks. I think what we're focusing on, I think that the biggest challenges we're seeing are staffing shortages and test kit shortages are becoming a little bit of a challenge. So I think we're all learning to become better stewards of our testing to try to avoid unnecessary testing for repeat indications. We're looking at ways in which to leverage this new CDC guidelines around crisis for staffing return to work so we can get people back in the workforce to protect and care for these loved ones, for all our loved ones here in the region. We're also starting to look at new therapies because hands down, the best thing we can all do is get vaccinated and get boosted. But for those who get infections, especially those that are immunocompromised, we're now looking at oral antiviral therapies. There's also a newer monoclonal antibody that appears to be best suited for the Omicron variant. So these are all tactics that we're using to best position ourselves to overcome this most recent surge.
Doctor, it's also our understanding that children are also being admitted at a higher rate. Do you have a message for parents, and what are the long-term effects on kids?
So the message to parents, you're absolutely right. We are seeing a 2 to 3-fold increase in the number of children being hospitalized across the state. The things for parents, I think you just have to keep them safe. So how do you best keep them safe? One is to vaccinate all those around the children who are eligible to be vaccinated. Nowadays, if you're 5 and up, you can be vaccinated. So those that are under 5, they're vulnerable. You have to protect them. How do you protect them beyond vaccination? You should keep them really out of harm's way. So don't put them in positions to fail, like put them in a large gathering space, especially an indoor gathering space. If you can keep a mask on a young child, that's really the best thing you can do to protect. The other thing is that you want to keep anybody who's ill away from these young children. So even if you get a non-COVID infection right now, that's really not good for these kids. They should be able to go to school. I know that some schools are putting it on pause. We hope they can get to school. But if you're sick, you got to keep them home. And if there's anybody around them who's sick, really try to keep their distance so you can keep these kids safe, because any one of us could have COVID and we could transmit it to these vulnerable children who are incapable of being vaccinated.
And doctor, is this increase in kids testing positive, is it a result of more people testing? Can you put some of those numbers into perspective for us?
I don't think it's a more aggressive testing strategy. I think that it's clearly the Omicron variant, which we're seeing much more of it within our own state, appears to be more contagious. I think that we as a society have let our guard down a bit. I think that there's been a lot of gatherings through the holidays. Lots of stadiums are open. People are going to the movies. There are places where a year ago we stayed away. I think the vaccine, which is absolutely the best thing we can do, has given folks a sense of security, and perhaps we've let our guard down. So I do believe there's truly a higher number of children being affected. As I said, hospitalizations are 2 to 3-fold higher than they've ever been within our state. So that clearly indicates that it's a higher level of spread. It's not just a greater testing.
Dr. Rudolph Valentini, Chief Medical Officer at DMC and Children's Hospital of Michigan, grateful for your time and expertise today, sir.
Thank you for having me.